Good evening. I'd like to call the City of Roswell Mayor and Council Budget Work Session to order. The budget work session will be led this evening by Human Resources Director Jim Harder. I know that if you don't know, I would like to offer condolences from obviously the mayor and from the City Council and from all of his colleagues. And I'm sure that the public would also like to wish their condolences. Jim lost his mother last week, and we know that's never easy on any of us. So, Jim, our condolences and love, and sorry about that, but just want to let you know we're thinking about you, brother.
Thank you. Appreciate that very much. Thanks to everybody.
So, Jim, with no further ado, you're going to take us through a compensation and benefits review. So the floor is yours, sir.
Okay.
Oh, by the way, I failed to mention, we have a quorum, and Councilman Palermo and Councilman Zapata both have excused absences from this work session. Thank you.
Okay, well, good evening. And as the mayor said, we will be talking about a few topics this evening.
I can pull it up on my computer.
We'll start off with employee compensation and benefits. Green light, yeah, sorry. You can tell I'm not too familiar with this. So, as I said, we'll start off with employee compensation and benefits and then feed into other aspects of the budget. And here's the agenda. Again, compensation and benefits. Then the finance staff will review proposed revenues and fees, followed by budgetary comparisons with neighboring cities, and then next steps in the budget process. So, beginning with personnel compensation and benefits, for your consideration for the budget and potential merit increases, I've put together a 12-year history for the City of Roswell on employee compensation adjustments. And you'll notice it's by fiscal year and 2 columns. On the left are merit increases. Those, of course, are associated with just that, employee merit, how they score on their employee evaluations. And so the numbers you see up there are the average. Some employees, based on their evaluation score, will receive a smaller merit, some slightly higher, but the departments are held to that percent overall. And then on the right, less frequent are market adjustments as a result of compensation studies. And you see we've done one here recently that was conducted, I'm working from the bottom of the graph here, was conducted in fiscal year 2020, and then was implemented in 2 phases. You see in FY21, half of it, 4.5%, was implemented. That was in March of 2021. And then the second half was implemented just this past January, along with the merit increase. So this just gives you a breakdown. The previous comp study for the entire city was done in FY16, resulting in the adjustments you see there, 6.8% on average for public safety and 5.5% for the other employee classifications. And then in the fall of 2018, fiscal 19, we did one for just sworn police positions. And as you know, as part of the mayor's and council's 100-day plan, we're currently looking at police positions again. One other slide comparing compensation with our market or our peers here locally. This one, I only have data going back 5 fiscal years, but you can see the cumulative effect with these cities, Roswell and the 4 other comparison cities, of the merit increases done, again, over the last 5 years. So just for illustration, the average of those is 20.23%. So Roswell as a city is right in there. Because you can see there was some zeros and some preceding zeros in the years before that, but for lack of a better term, we caught up somewhat with the compensation study. But with the labor market as it is, keeping up will be a challenge going forward. Any questions I can answer on the comp? Yes, ma'am.
Thank you, Mr. Harner. And these compensations, do they include bonuses, or is this just base pay.
Yeah, you're right. So there are a couple years they do not include that. They just include any kind of pay adjustments, either through merit or comp studies. There were a couple years there, you're right, where no merit was given by mayor and council, but instead we gave a one-time, like $1,000 full-timers, 500 part-timers. That's not included here. Yes.
Jim, I apologize, two things. I failed to, in the beginning of the meeting, to introduce City Administrator Randy Knighton, City Attorney David Davidson, my colleagues, Councilmember Christine Hall, Councilmember Peter Vanstrom, Councilmember Lee Hills, and Councilmember William Mortland. My apologies, and our City Clerk Marley Press. So my apologies for failure to introduce everyone at the beginning of the meeting. Sorry, and now I have a question.
Yes, sir.
So you've got a 5-year study, which I love. The previous chart showed all the way back to 2010.
Right.
Do we, the first question that rolled off my head, and I was figuring you're probably going to get to this, was what's the aggregate percentage of increase for the City of Roswell from 2010 through 2022?
I'll need to go back and calculate that.
Okay.
I did not do that, right?
Okay.
So, and I just did Roswell there because, again, I didn't have historical data from those other cities going back that far.
Okay.
I will calculate that.
Thank you, sir.
Sure. I'll get that back to you. Okay, so then moving on, looking at benefits, we have a very generous and competitive benefits package, and we do benchmark that, by the way, as part of compensation studies too. So it's not just the pay ranges, but it's also the benefits package. And the most recent study we did, again in 2020, found that our package was on par. Biggest part of that, of course, is health insurance. So just a little background information on that, showing the different coverage selections by the employees that are eligible. About 41% select employee-only coverage. About 50% of the employees select dependent, either employee plus spouse, employee plus children, or family coverage. And then we do have about 9% that waive Roswell health insurance, usually because they have health insurance elsewhere. Just for your information, we did transition as a city to a self-funded plan in 2014, and that has served us well. Certainly the costs of being fully insured by any carrier had gotten high and continues to grow. And by being self-funded, we can affect costs ourselves through wellness plan, through different, employees have more buy-in if in that kind of case. So it's served us well. And I'll show you the slides in a couple seconds showing where we are on that. Our current plan offering, it does include 3 high-deductible HSA or health spending account plans. You can only offer an HSA by IRS rules if you do have a high-deductible plan. And then we have one traditional, or what you would consider one traditional PPA or co-pay plan, the old plan that's kind of going away, but you go in and write a check for $25 or $30 and get the works. So we do have one of those. Premium, of course, for that's a little higher, but some of our employees do prefer that type of plan. This is how our group health fund has performed over the last 5 full years and so far in the current plan year. So what we're showing here is by year the total claims, both medical and pharmaceutical claims, and then the attachment point. Because we're self-insured, we also carry stop-loss insurance to keep the city from having catastrophic, financially catastrophic aggregate claims or even specific claims on a specific case. And so what the attachment point represents is the dollar amount of claims at which that reinsurance would kick in, okay, and reimburse us. So that would be the maximum we could pay in claims for that year. The paid loss ratio is important because when we come up for renewal, that's what the reinsurance carriers will look at, just like on anything you insure. If we're getting close to having to file a claim and coming right up against that number, they're going to raise our rates. And we do renew those each year. And our plan year starts in October. We'll be back in here with quotes on reinsurance and everything else this summer. But you can see that we've been as high as 90%. Last full time year was 86%. Currently, we're on track. If it keeps up this way with the first quarter of this plan year, we're sitting at 61%. And this is measured as you go throughout the year. So we've got a chance for a very good year, and I'll tell you a couple reasons we think, a couple things that we think are responsible for that. But any questions about the attachment point or reinsurance?
You're going to address PY 22. You're going to address the staggeringly different numbers there.
Yes, sir.
Yes,
Yeah,
sir.
absolutely, yeah. And I should have mentioned too that our plan year is a little different than the fiscal year. So it started October 1st. So what you see here is represented through December. Very soon here, I anticipate the middle of April, we'll get second quarter, and I'm hoping for continued good news. So, but this is the first quarter of the plan year. Yes, sir. Okay, so what are some of the things that we think have helped start the year off right, at least, or start the plan year off right? Well, one of the things we did was we went out to market. Our benefits consultant does this on our behalf, One Digital, and shopped the market, and we did make a change to our pharmacy benefits management company. It was Magellan, and we changed at the beginning of this current plan year to Maxor Plus. One of the reasons we did that is that their drug acquisition costs were lower. So right away, you start off with lower costs there. They also implemented a number of cost containment programs. Now this involved, more cooperation from employees on it, but when someone needed a specialty med, particularly very expensive specialty med, that was where we were seeing some of our highest costs were on the specialty prescriptions. There'd be a case manager that would reach out to them. Also, there's actually alternative sourcing, actually coupons for these drugs that the pharmacy benefits manager accesses. Sometimes the employee fills out an application to tap into a federal program. But by working through that, I'll show you in a second, so far again, our prescription costs are down this year. And that's been the part of our claims that's grown at the fastest rate. Not unusual there, So how's it looking? Well, again, for the first quarter of the year, October through December, overall, our prescription costs are down 33%. So that's a pretty good chunk. You never know what kind of diagnoses an employee or their family are going to have. So it's hard to predict that, but if we can make sure our specialty costs are less, that should serve us well. The city and employees share in any of those kind of savings because, again, both the city contributes premiums, the employee does, and then, of course, the employee has co-pays. But so far, $67K in city savings and $72K among the employees who use the benefits. And happy to say, so far, specialty RX costs are down 57%. So that's a trend we hope continues. Just another note that, and this is not unusual, although at Roswell it's been a little bit higher than average. Large claimants, so employees that have a situation that costs over $100K in a single year, typically that's less than 3% of our employees, but those folks account for 30% of the total claims. So the average is about 181. But that's what we have insurance for. It can happen to any of us. So just an interesting statistic. And then busy graph here, but this is one I like because it shows how we compare to other similarly situated employers throughout the country. I'm glad to see this graph. We're in the green, by the way, is down so far this fiscal year or plan year. We'll see how it continues. We had inched the previous year up above the average a little bit, but so far we're trending toward about a little over $11,000 in gross costs per employee, and the average is about $14,800. So hope this trend.
Jim, can I ask you a question?
Yes, sir.
Are you going to, you may address this in a future slide, so if I'm ahead of myself, I apologize. It looks like, just looking at us on our historical basis as compared to the national basis, although we're lower with the exception of 2019 and 2020 plan years, those are plan years, correct?
Right.
Which is great to be lower.
Yeah.
But what's interesting is the national averages are dramatically more consistent in terms of the upward mean, whereas ours tend to have a lot more jumps up
Right.
and down.
Fluctuations.
Yeah, fluctuations. What do you attribute that to?
What we've seen in the last few years, actually last 5 or 6 years, is a higher number of specific claims that are above that 100,000. So while the average employee claims have certainly grown, you can see the slope of both those lines is positive. We've had a fair amount of bad diagnosis, cancers, premature babies, those kind of things. And that's going to happen to any employer group, but our consultant tells us that we've had quite a few. And in some years, there were none, so it's fluctuated quite a bit.
To your point, you've got some dramatic moves upwards and downwards. And you look at the national average, it's pretty steady. It's continuing to move up, obviously.
Sure.
And as well as ours, but you actually have a downward trend in 2 years.
Right.
In 2015 and 2017, you actually go down.
Sure.
So does the consultant say that Roswell is just had a little bit more bad misfortune with some of the poor folks that have had some, that we just a little bit out of the norm on that? Is that what the consultant says?
That's what they're saying is unusual about our claim history is two things. The amount of specific claims, those ones that again are above the 100K, which again doesn't happen every year, but it's hit us on some years pretty hard, particularly last year and year before that. And then also a higher portion of our RX spend has been in the specialty drugs. And part of that's as a result of those higher claims, because anytime you've got some of those really bad diagnoses, there may be one drug that treats that, and it may be $8,000 or $10,000 a month, some of those, so, yeah. But I think that, hopefully, the specialty RX focus will help us, smooth it out a little bit.
To your point, these are all large cities. This data is it's all attributable to cities.
Similarly situated, yes, sir.
Yes.
So, typically government entities, even in this region, in the south, and I should have pointed that out, with 500 to 999 employees. So, and we've got about 500, at any given time, about 580 full-timers, which would be the group. We have more total employees than that, but 580 or so would be the ones that, eligible for medical insurance. Yes, sir. Okay, a couple other quick things, and one of the ways we do try to affect it, besides the case management and RX cost management, is our employee wellness program. And this is something that we've got a staff person in HR, Heidi Weiss, dedicated to wellness and workers' compensation. And she's really good at coming up with new ideas, dropping things that don't work, those kind of things to get employees work toward wellness. And the elected officials, you all have supported the wellness program. If folks participate in this, they get a credit toward their premium. And in fact, that was even increased a couple years ago, and we saw an increase in participation. But you can see the percentage of folks in our health plan who participate actively in the wellness program, and where the real cost savings are, besides employee health, the most important thing, but the cost savings come from managing chronic conditions. Not so much from getting somebody to go to the gym, although that's great and we need to do that. It's getting someone with diabetes or weight management or blood pressure or those kind of things in to make sure they're getting their medication, that kind of thing. So the wellness program is really, really good for that. We appreciate and hope for your continued support of that program.
So is that, because you took us down an interesting line there, kind of saying it wasn't this, and I'm reading here, group fitness classes, competition race reimbursements, et cetera, which sounds fantastic. Weight Watchers,
Yep.
Those kind of things, great programs. A lot of folks would want to be involved in
Right.
that. So how do you do like competition race reimbursements, for example?
Yeah, so it's, if I believe that if you enter a race and provide some kind of documentation, did it, the city simply reimburses you, I think it's up to $25. So, that's one that was recently added. And then I should have mentioned that I skipped the first bullet point. To be in the wellness program and receive that premium reimbursement, the employee has to participate in biometric screening, and then based on the results of that, coaching throughout the year. Meet with their own doctor or at our clinic, and follow up on different things. So that's a big part of it. Yes, sir. Oh, yeah. This one. All right. Yeah, I believe that was done in,
Well, nobody's going to the doctor during COVID. Like, that's why it dipped 2020, 2021.
right, we had that.
People laid off going to the doctor and any kind of elective or extra credit medical services. Oh, my bad. Too late.
Councilmember Hills, feel free. We'd love to hear it. Yeah.
Yes. Do you want me to repeat that?
Yeah, so you want to go back to you want to go one graph forward?
I'm guessing, but in 2021, from 20 to 21, folks dropped off from going to additional doctor's appointments, or I just think it wasn't recorded there. I think during COVID, a lot of people took care of themselves at home and didn't make claims. They didn't go to the doctor, so I could that. And then I'm looking at the other two trends in 2014, where you may have had a spike, 2014-15, and the same with 16-17. Maybe somebody did have cancer. Maybe there was a massive health incident or crisis, and then it would dip right after that because those folks are no longer, they've taken care of themselves or gotten care. So there's going to be a reduction in the numbers there.
Yeah.
Well, sorry. So Lee, what's interesting for me looking at this chart, and what you just said to me sounds intuitive and logical, but it doesn't coincide with the national part. So if you look at the national, 2020, 21, and 21, 22, the numbers are still moving up. Roswell went up in 2021, first year of COVID, and then in 21, 22, had a dramatic decrease. So what you're saying is logical, but the national doesn't support that. It still supports that the cost per employees are going up, which would, I think, make a general assumption that the medical costs, i.e. people going to the doctor, and I hear you loud and clear,
Yeah.
you're right.
Yeah.
That sounds very intuitive and logical, but just look at the distinction there. Nationally, they continue to go up. And we went up in the first year of COVID and then went down last year. This is plan year too.
Yes.
That's right. So these dates would be October 1st of 2020 to September 30th of 2021.
That's right.
And then the 2021 would be October 1st of 2021 to September 30th
Right.
of 2022.
Right, and that 11,000, the good number that we hope holds a little bit at the end is just representative of 3 months of data projected for the rest of this plan year. So that's why it's slow. The other thing,
And to be clear, your consultant or our consultant says we've had just more. It's been disproportionate, or we've had some of our folks just have more bad luck in
Yes.
terms of bad serious illness.
that's exactly right. We've never, in stop-loss insurance, you have two different protections. One is on aggregate. Total claims for the city will not exceed this amount, or you get reimbursed. And then, of course, the next year your premiums go up. But then there's specific loss. So if any employee has claims that exceed 200,000, then, and some of them do, with some of this bad, then we get reimbursed. But the fact that employee had such high claims, we've had a higher history of those here in some of the years. The other thing to keep in mind about the blue line is that is an aggregate of all similarly situated employees. So you're going to see some smoothing in that line, because not only is Roswell in that mix, but there's also other employees who had spikes in different years. But on average, you get a little more smoothing with the aggregate blue line. But yeah, we've had some
When you Jim, when you go forward one more back where you were, and I know this is not major stuff. So, on the group fitness classes, for example, I mean, it sounds fantastic, and Weight Watchers sounds fantastic. Sounds like great stuff that we ought to be participating as an employer in. Being here, how does that get proselytized to all the employees?
Yeah, so we send out, again, the person in my office, Heidi Weiss, who is the coordinator for the wellness program, sends out announcements. She collects the data and processes the reimbursements to employees for those different things. So some of it's also included in our employee newsletter that goes out. So usually email, the newsletter, this kind of thing.
I'm assuming that as a professional in this, you have got clear data that shows employee workforces that participate in wellness programs, not just biometric screenings, but specifically where you are not encouraging but incentivizing.
Right.
That the numbers, what it does to the reduction of your healthcare costs.
Right, exactly.
Are you going there here in this? Are you going forward?
I don't have those numbers with me, but I can certainly, pull some of the source information.
Well, I would say that as an employer, since we are an employer of 580 full-time folks, it would be my desire, and I hope it would be the council's desire, that we would encourage that even more dramatically. That we would make that a revolutionary part of our city's wellness program. That everybody is participating in a wellness program. Obviously, they don't have to, but that we would create such a tremendous amount of inertia in everyone's own personal best interest, number one, right? Just in their own personal best interest.
Sure.
Two, that it helps us as an employer. People, when they're more healthy, they're more productive, they more enjoy their job. And three, costs go down.
Right.
So just speaking for me personally, I would love to see a much more aggressive program, Randy, on this, that we're really sensationalizing it, if you will.
Okay.
And looking for real bang in the buck returns on one, employee joyfulness, productivity, and health. And then from the standpoint that we see the return on the dollar from the cost perspective.
Sure, absolutely. Yeah. And then I believe the last slide I have here is a little bit of a descriptor on our two retirement plans. You may already know that we have two. One was frozen in 2011, and participation in these plans based on when you were hired with the city. So the first one here, the DB, defined benefit plan, is more your traditional pension. And that's the retirement plan that was in place for all employees that came on board through February 28, 2011. So it's got a typical defined benefit pension formula, based on years of service times your average earnings times a certain percent, and that can vary, but here it's 2%. Currently, about a third of our employees that are with us currently are on that plan because they came in under that plan. Since then, or since actually March 1st, 2011, the other 2/3 of our employees are on a more defined contribution plan, a 457, 401 plan, where it's just that. The city's contribution is a set amount, and then the performance or payout, if you will, the plan depends on markets and investments and all of that kind of thing. The city contributes 10%, and then in that case, and then matches up to 5%. So a very attractive and good plan. So
I'm going to ask you a layup question, but I think it's worth answering it publicly so that the public can know. Which program is less expensive to the city?
the defined contribution plan is less expensive.
And and statistically, percentage-wise, how much cheaper is it, if you could put a number on that?
Sure. I don't know what the average, or have readily available, the average amount that an employee contributes himself. So let's say they contributed the maximum amount to get the match, then it would cost the city 15% per employee. Some folks don't contribute enough for the match, which of course they should, but they don't, and in that case, it's costing the city 10%. But,
And that's something we're working on, I'm proselytizing as well, is for employees to be aggressively investing in their own defined contribution plan.
yeah, and we do that during orientation, but certainly to your earlier point about the wellness program, we can always be doing a better job and more often and better, more quantity and more quality about.
More quality, and it's the best thing that happens for the employee themselves, right?
Right.
Not necessarily for the city, but there's a benefit to the city, but the real benefit is to the employee.
Yeah, and I'll tell you from a recruitment and retention, our plan is good. In fact, this is one of the ways where we're as good or better than some of the other municipalities. Not overly so, but it is a helpful tool to attract and retain employees.
So on your if I come to work for you today, I'm going to get a 457 401k program. Is that
Right.
correct?
401A,
401A 457, and the city is going to take 10% of my pay and put it automatically into that program.
even if you contribute nothing.
Wow,
It's really good.
that's pretty good.
And then another.
10% automatic. That's
Right.
pretty darn good.
Right, and even when it changed, it was definitely a savings though, because the contribution that's made, and Ryan may be able to help me, I'm pulling my wingman here, on the percent the city contributes, what percent is that for pension that, is it 30, 20? I'm sorry, I put you on the spot. We've got it, we just sat down with Siegel Consulting and they've given us some numbers, but.
It's, the total amount the city contributes annually is between 3.5 to 4 million, still on the defined benefit plan.
Yeah, so currently here in FY '22, the city of Roswell is contributing between $3.5 and $4 million on the old defined benefit program.
Right.
And obviously, that stopped. There weren't any new people participating in that program as of February 28, 2011, and yet you're still contributing $3.5 to $4 million. And it's worth noting why cities, states, city and state governments got out of the defined benefit program, because people, from an employee perspective, it was great. But what governments found out was they just couldn't afford it. And that's why a lot of cities and state governments got in severe financial crisis, was because of defined benefit programs.
Sure.
We still have 1/3 of our workforce on the defined benefit program.
That's correct.
Do we have a rollout schedule of what that looks like in terms from a monetary perspective of, because obviously that's going to age out at some point, correct? Do we know what that looks like on a financial table?
We recently met with Siegel Consulting, who on behalf of the pension plan does an annual evaluation on the fiscal soundness of it, and they do have modeling based on that. And I should say too that our plan is very healthy. I think we're at 83% funded, and some of the municipalities, many throughout the country that in the 70s and 80s got in real trouble and gotten down to 50, 40% funded. Fortunately, ours stays fiscally sound. But yeah, Siegel Consulting does modeling saying, hey, based on the age of your employees, and here's what this looks like, and here's what we think you should contribute or consider contributing to keep it fiscally sound. So,
Have you? Since it's just us girls talking. Have you heard? Because one of the criticisms I get from city employees at times, particularly those who were here February 28, 2011 or before, was naturally the taking away of the defined benefit programming and going to a defined contribution program. And what I'm curious is, from a recruiting and retention perspective, how much better are we than our sister cities in terms of our defined contribution program?
right. So I do know one, and it's not exactly a real close peer, but Cobb County, for instance, let me just give you an example there. They did the same thing like in other municipalities, where they had the defined benefit plan, and then they really stepped down. I mean, really took a huge step down for employees hired after a certain date, and I think the contribution may be like 4%. So you go from defined benefit to 4%. Well, course, the folks that are still under defined benefit are fine, but they're having a hard time, and that's just one example.
Let me ask you another question, just kind of following up this. So do we have any modeling, just out of curiosity, that if we had not done away with the defined benefit program and we had not created a defined contribution program and we were still on a defined benefit program today, where we know we're going to spend between $3.5–4 million in FY22, and everybody was on a defined benefit program, what would it have cost the residents of Roswell? What would that, do we have a modeling on that?
I don't believe we do, no.
I haven't seen one.
Sorry to ask you a question out of the blue, but it is a curiosity question I have, because obviously, the reason we don't do it, it's not because we don't want to be a great employer, it's because we can't afford to do it.
Right.
That's the real reason. And I know that, and, you know, obviously you want to do as much as you can for everybody. But the real reality is the reason we're not in the defined benefit program today, business today, is because we can't afford it. But I think we do need to explain, because people are going to ask, so why don't we do a defined benefit program? If it is, people perceive it as better, and many do, for obvious reasons, what's the cost differential? And so, you know, is the cost differential $10 million a year? Right? Is it $12 million a year? And how does that grow based upon the way the wages grow over time, which you have simple modeling for that. It's not hard to come up with, but I think people appreciate it when we give them hard numbers and say, by the way, we have a defined benefit program. We cut it off February 28th, 2011. We still have a third of our Roswell employees that are on it. And it runs us about $3.5–4 million to support that defined benefits program. Whereas we have a defined contribution program, and where 2/3 of our employees are on that, and it runs us so much in FY22. What's the number on FY22 on the defined contribution program?
Sorry, I don't have the.
That's okay. No, yeah. But I think those things help, and I think they help council, because they get those kind of questions, like, and just from a standpoint of human empathy and being a good employer and saying, look, and also saying from a competition perspective, look, we're doing better than our sister cities. We have a much more aggressive defined contribution program, and want to continue to enlist in making it better and better. But thank you. Sorry.
Jim, one more,
Yes, sir.
and I might have missed it. Do we have the city contributes 10% of the defined contribution. What are sister cities contributing? I mean, you mentioned Cobb. I would love to know more about what the competition is like out there as far as what we're offering our employees. And then, of course, then looking at the numbers you're talking about, that sliding that number would make an impact of how much it costs us.
Right. Yeah, we have access to that data, so we can get that to you from part of the comp study we most recently did.
I think Peter's saying we'd love to see a schedule, kind of like you did on the pay scale. Let's do a defined contribution comparative scale as well, if y'all don't mind.
Will do. All right, I think that.
This is Christine's expertise. I'm surprised she's not saying anything.
I have a question. I was waiting for these to be done.
Hey, Mr. Horner, I've got a quick question before she jumps in. Are our employees taking advantage of the employee clinic? Can you
Some
touch
are.
Can you touch on
and
that?
that's
The hours, what they can get?
It's a great benefit,
Okay.
but there's still definitely capacity there. We started doing some occupational health things there as well, drug testing, but yeah, we definitely are always looking to promote the clinic and get more folks over there. It's great, it's very low cost, and
What are the hours of the clinic?
the hours, we've expanded, it's now open 3 days, was just Tuesday and Thursday. I believe now it's Monday, Tuesday, and Thursday. And if we can fill those up more, I'd certainly love to come to you all and say, hey, we need more money to open the clinic more days. So,
One of the big things I found as being a big benefit to the employees is if you just have a run-of-the-mill cold, or you feel as if something is about to come on, you can go to the clinic for a Z-Pack, something along those lines.
exactly.
I thought that was genius.
Yeah.
Will, can you tell, I mean, sorry, I'm completely ignorant. I don't know about the employee
So
clinic.
let
It's
me-
the first
let me
I've heard of it.
Let me start over. Can you touch on the employee clinic?
So we've got an employee clinic right around the corner here on Oak Street, and at Waller Park. And in one section of that all full-time employees are eligible to go to. It's run by a company, well, they just changed their name. They were HealthStat. Can't remember Amy, what's their name now? Do you know? Everside, thank you. But they also run some other employee health clinics, one in Cobb County, I believe Cobb County, a couple other municipalities. We started that in 2016, and there are a lot of employees that are raving fans, but we do need to do a better job of getting folks to go there. It's great for folks it's particularly utilized for folks that are here working and, to your point, need to go. But the other challenge is we only have 29% of our employees live in Roswell. So getting it to where family members want to drive that distance to come. But it's a great benefit, yeah, definitely.
Sounds like an interesting, cool, strategic, do most cities have?
No. In fact, when we started it off, we went to some of our sister cities, Sandy Springs, Alpharetta, and said, hey, do you want to go in with us on this? And their reaction was, you go ahead, we'll see how it goes. So, yeah, it's a cost for the city, and it's certainly not one that absolutely pays for itself, except for, morale, convenience. And again, we've recently changed our wellness program. Remember I talked about the biometric screenings and the follow-up coaching? That's now done through the clinic. Number one, to consolidate vendors, so we didn't have a separate vendor for wellness and the clinic. But more importantly, to get folks over there that aren't going, get them more familiar with the clinic. So it's a great benefit.
What would your aspiration for that clinic be? What would you like to see? What kind of participation would you like to see in that clinic?
I'd love to see them busy all the time over there with appointments, and then again, for me to come back to you and say, hey, I need to be able to open the clinic more days because they're busting at the seams. Right now, we're not there.
What do you, and Jim, from your perspective, what does that do for the standpoint of employee morale, healthcare cost, time off from work? What are the attributes of having a health clinic that you're saying, look, I want to sell this and I want to make this more prolific? What are the true attributes? What's the impact there?
Well, I think first and foremost, it tells the employees we care about their health, and here's something right here, convenient to you. By the way, we let them go to visits without, you can go to the healthcare clinic right around the corner. You don't have to use any sick time, unlike when you go to your own doctor and take time off. It's provided at low cost. I think the average script over there is $12,
Wow.
something like that. Now, it doesn't carry everything. It carries the most basic, the Z-Packs and those kind of things. But
So how are we doing in communicating the clinic, do you think, to our employees, to our 580 employees?
I think it falls under the same category. We can do a better job. We do communicate it. Again, newsletters, flyers, but always something we can improve.
Can I ask a tough question? And you can turn towards Marley and not watch the answer.
Yeah.
Turn this way if you want to.
Okay.
Okay, watch this. So everybody here is an employee of the City of Roswell, I think. So how many of here have been to the health clinic by show of hands? 1, 2, 3, 4. Pretty good. All right. By the way, technically, the council members are all employees, I think, or not employees, but they have access to the health clinic. How many of you knew about the health clinic before this conversation?
I did.
2 of 5. So maybe it's just the electeds are the problem. It usually is.
No. Right.
It's usually the electeds that are the problem. So, and maybe there's there's probably an active desire by you to not want the electeds to get there so they can be ongoing sick and not show up to harass you, which I would understand.
I'll make an appointment for you on Monday night, you'll know that.
That's
right?
perfect.
Right, yeah.
I need to go there in about an hour and 15 minutes. I'm gonna be coming down with a little cough
Right.
and sickness, and to anything I can do from, yeah. But I think you're right. I think your point is, I would, Randy kind of, with this communication strategy, we haven't talked that much about the internal communication strategy a lot, but I think that's an important part, particularly when there's real impact and real benefits that can be brought to the quality of life to the employees, and a reciprocal impact towards cost savings to the city.
Sure, absolutely. Okay.
Oh, Christine.
Oh, I'm sorry, yeah.
This is just a question going back to the high deductible programs and the PPO program.
Yeah.
So the folks that participate in the PPO, are they eligible for the HSA, the Health Savings Plan?
They're not, no.
So do we have an FSA for them?
Yes, so we do offer an FSA that, do we still offer that, Amy, FSA, flexible spend? Okay. It's my benefits expert, but yeah, so.
So it's just limited to dental and vision? And is there a reason that they can't also get medical under that FSA? Because I'm familiar with organizations that have both. And for those that opt to go with a PPO type of plan and not a high deductible, they're able to use their FSA for basically all the things it's intended to.
We'll check on that, but of course, it is an IRS regulation that you can't have an HSA, or you can't have the tax savings of it, so if you're not enrolled in a high deductible plan, as you know.
Correct.
But for the others, yeah.
Yeah, thank you.
Other questions I can answer? We'll get this other data that you requested, so. Revenues fixed. Thank you all. Thank you. Sure, thank you.
That went a lot longer than you anticipated, didn't it? And by the way, how much money did you pay everybody that walked in here on the staff? This is incredible. They all raised their hands. They must like you, Jim.
Good evening, everyone. So we'll move on to the revenues and fees part of our discussion this evening.
And this is, by the way, Finance Director Ryan Luckett, who will be conducting the second part of our discussion tonight. Welcome, Ryan.
Thank you. So we'll get started kind of high level and dig into some details as we move forward. The first slide I wanted to show you here is an overall picture of our general fund revenues. So this shows you our FY22 revised budget, our FY22 estimate, and what we're proposing for FY 2023. So you can see our revised budget is 81.7 million. We're estimating that we'll actually bring in 87.7. That's about 6 million or 7.3% higher than our revised budget. That's primarily due to sales tax and our Tidewide Valorem Tax. Our sales tax has just performed, I think, beyond anyone's expectation. We've been about 15% higher than the prior year this fiscal year. So we're doing really well there. Our FY 2023 proposed revenues overall are about $1 million or 1.2% higher than our FY 22 estimate. And most of that increase is found in our franchise, alcohol, and business taxes, our transfers in, and our charges for service. And I'll get into those details as we move forward. So if we're looking at our FY 2023 proposed revenues, as I mentioned, 88.7 million. This is kind of how it's broken down among our major categories. So about a third of our general fund revenues come from property tax, the property tax category of revenues, about a third from sales tax, and then the remaining third is split between our business taxes and other miscellaneous taxes, or fees. So you can see here our the other category, about 12%. That includes our charges for service, licenses and permits, miscellaneous items, fines and forfeitures, interest, and intergovernmental revenues. So that totals about 10.2 million. Business taxes come in about 17.8 million, or 20% of our overall general fund revenues. So I'll start with our property taxes. And we saw this slide when we talked to you about the 5-year forecast, and I just wanted to kind of reiterate it one more time. When we talked to you about property tax as a category as a whole, a portion of that category includes revenues that are driven by the millage rate, which is adopted by mayor and council. A portion of that is not driven by the millage rate, but still falls within that property tax category. So if we're looking at the City of Roswell's overall property tax digest, in FY22, the digest totaled $6.5 billion. About 95% of the digest is in real property, so about $6.3 billion. The other components of our digest include personal property, public utilities, and motor vehicles. Just to kind of give you a big picture idea of how the process works, so the property values themselves are determined by the Fulton County Board of Assessors. The values are provided to the City of Roswell in about the early July time period. In the past few years, the millage rate has been set by mayor and council in July or August, and then tax bills are issued by the city in the September-October timeframe. So looking at our property tax projection for FY 2023, our projection was based on what our current digest value is with estimates for exemptions, appeals, and growth. So we spend, most of our time, as you saw, 95% of our digest is real property. So that's really what we focus on primarily to make sure that we are taking everything into account. So when you're looking at residential real property, we're estimating new growth of about 2%. And when we say new growth, we mean new construction. So that's based on COs that have been issued by ComDev during the appropriate calendar year. On the commercial, also on residential real property, the other component to this is our floating homestead exemption. And that floating homestead exemption controls what inflationary growth occurs on an annual basis. So we already know what that percent will be for this upcoming year, and that'll be 3%. And the exemption itself caps our inflationary growth at 3% annually. It's that or the lower of the rate of inflation. On the commercial real property side, we're estimating new growth or new construction of less than 1%. And again, that's based on the activity that's been seen by community development. And then inflationary growth projected at 3% on the commercial side based on historical trends. So that digest value then gets translated into revenue. And that revenue that we are currently including in the proposed revenues is based on the current millage rate that we have today of 4.718 mils. Breaking down our property taxes a little bit more, so the city does offer 4 different homestead exemptions. And as you can see here, the exemptions reduce the total assessed value for the city's property digest by about $708 million. So that number that you saw on the previous slide, about $6.5 billion, that $700 million comes off of that number. So that translates into tax savings for residents of a little over $3 million on an annual basis. The table on the bottom right kind of breaks down the different exemptions that we have. So anyone over 65 qualifies for a $2,000 exemption. That's off of your assessed value. Over 65 with an adjusted gross income of less than $40,000, it's a $20,000 exemption. We also recognize the federal disabled veteran exemption, and that takes another $98,000 off of your assessed value. And then the floating exemption varies based on the actual piece of property. So as you can see, if you're looking at the value of the exemptions, 94% of all the exemptions that we have is related to the floating homestead exemption. The other 3 that we offer combine total about $45 million in assessed value that comes off of someone's property tax bill.
Sorry, Christine, go ahead, sorry. Ryan, are you going to take us through the floating exemption?
I can explain it more if you'd like.
Well, it's the preponderance of money, right? So obviously, from an informational perspective, it might be good to know what that is. Yeah.
So the floating exemption went into effect, I believe it was in 2019. It was something that the state legislature put into place through a referendum, and so Roswell residents voted it into effect. And basically what it does is it establishes a base value for every single parcel, and that base value can grow by the rate of inflation no more than 3% on an annual basis. The difference between the base value and the assessed value for that property is the amount of the exemption that someone receives. So the assessed value of someone's home can grow 15%, but their base value only grows max 3%. So the exemption amount is the difference between that assessed value and the base value for that piece of property. Since it's been into place on an annual basis, I would say it's probably, $650, $675 million is the amount of assessed value that's come off our digest. And as you can see, it's about 17,000 parcels in Roswell. We have about 30,000 total. So about 17,000 parcels have the floating exemption. You qualify for the floating exemption if you have the basic Fulton County exemption on your property. So there's no separate qualification process for residents to follow for that.
I won't ask you the political question, but certainly behind, remember when it happened in 2019. Do you think that the majority, just from your perspective, your professional opinion, you do this, do you think that the majority of residents have any idea that they're participating in a floating exemption and what it means and what the difference is?
I really don't know the answer to that question. I mean, most people, I would say, by evidenced by the numbers, and the fact that it's an automatic qualification through the Fulton County exemption, are participating, whether they know it or not. They see it on their tax bill.
Right. 60% are participating.
Mm-hmm.
That's right.
Yep. And I will say too, in the midst of that, is the fact that when a parcel turns over, they wouldn't automatically get the exemption. It's, they have to have lived in the home as of January 1st of that year. So there's always going to be some percentage of turnover.
And what the numbers address is the significant amount of turnover that occurs in the residential market. That's why it's 60%, not 85%, is because the amount of turnover in housing.
And I will say, just as a caveat too, so the 30,000 parcels I mentioned includes all parcels. So that includes commercial, but there's probably 2,000 of those out there. So.
Very good. Thank you, sir.
The other three, the over 65 with AGI less than 40, and disabled veteran, are those Roswell specific, and can Roswell change or add at any of those?
Yes, those are specific to Roswell. And I think the last time I looked, I believe they were approved probably in the 90s, maybe earlier. But it is approved. It's approved through the state legislature, then through a referendum to make any changes or approve new ones. But the city has the ability to make those changes.
So we could certainly add some if
Right.
it was relevant. Thank
Right.
you.
The disabled veteran, the only difference there is that that's a federal exemption that we recognize, and it's tied to a formula, so the amount fluctuates annually. So we really wouldn't change that one, but the other two, the senior exemptions, definitely are there for us to make any adjustments. So this graph shows you our real property digest history by type. So you can see the blue line here shows you residential, the orange line is commercial, and the other line includes some of our other miscellaneous types like agriculture, industrial type uses. As you mentioned before, Mayor, what you can see here, this jump really is what precipitated the floating homestead exemption. As in a matter of 1 year, our residential digest jumped by $1 billion. And so as that happened, here in the city of Roswell, the mayor and council at the time voted to reduce the millage rate by $0.5 mil to try and help compensate for some of the increase. This was prior to the floating homestead exemption, before it could be put into place. The millage rate was reduced to help offset some of the impact that residents were seeing in their digest value, their property values. But overall, what you see here is that our residential property values have increased 50% since FY 2010. It's about an average annual growth of 4%. Obviously, a lot of that happened in a matter of that 1 year. On the commercial side, much more Flat growth, 23% since FY 2010. It's an average annual growth of about 2%.
Can you go back that slide just for a second? So you've had, obviously, both a significant, obviously the residential side, everybody knows the story on the residential side. What's interesting, if you look at Roswell, was the trend line is literally static at 1% for 6 years, FY 2011 through FY 2017. You've got a static 1% increase in values on the commercial side. Not that it's outstanding, but you do see some significant increase percentage-wise in 19, 20, 21, and obviously 22, where you've seen it continue to move up a little bit.
And I believe also kind of what we saw here too was, I think the Fulton County Tax Assessor was trying to gain some ground on the commercial side. And you can see after that initial year, a little bit of a dip, and what we saw after that point was a lot of appeals on the commercial side, and a lot of those values sort of right-sized. They were still higher than they were, but not quite as high as the tax assessor had put them at during that particular year. So it's taking a look at the other revenues that fall within this category. As I mentioned, we have our Tidewide Valorem Tax. This is the tax that's paid at the time of vehicle registration. So this was this tax actually replaced the annual ad valorem tax that some people still pay today. Most people don't. But it replaced the annual ad valorem tax and the sales tax on vehicles beginning in 2013. The rate has fluctuated over the years, but it's now static at 6.6% of fair market value of the vehicle. 65% of that tax is remitted to local governments, 35% is remitted to the states, and it's heavily dependent upon the new and used vehicle market. We've been fortunate here in Roswell that the market has been so hot that our revenues here have performed really well. The split between the state and the state and the local governments has also fluctuated over the years. The legislature's tweaked it here and there in the last few years. It's been tweaked in favor of local governments, and we've really seen the benefit of that in the last couple of years. Lastly, we have two other taxes, our recording and real estate transfer taxes. These are two distinct taxes that are related to the transfer of property and real estate financings. These taxes are collected by the county and remitted to local governments. And again, the revenue here is dependent upon the real estate market. And so as you'll see on this slide, if you take a look both at so this is a summary of all of the revenues that fall within the property tax category. Tidewide Valorem Tax, we are factoring in some decline based on what we may see with some slowdown in spending. We're also factoring in some decline in the recording tax and the real estate transfer. A little more significant, those are not huge revenues anyway, but with the increase in rates coming, it's really outperformed the history in the last couple of years because rates have been so low. And we're anticipating to see some decline in that area, or really a return back to normal with rates on the rise. So with those decreases, that's kind of offsetting the increases that we're anticipating on the property tax side. So we're expecting about $1 million increase in real property tax. But as I said, some of that is going to be offset by the decreases that we're factoring in for next year. And again, this is for the general fund portion only. The next slide just kind of gives you a history of our tax digest and our tax revenues. The years represented with a star here, and I think we showed this to you at the forecast presentation, show the years that the millage rate was decreased, which explains, you can see our digest jumped, but not quite as high on the revenue side because we did reduce the millage rate that particular year. Our millage rate history, a 10-year history here for you. Going back to FY 2013, we were at 5.455 mils. That was split between our M&O, which supports the general fund, and the debt service portion, which supports our bonded debt. That has fluctuated over the years, and so today we are at 4.718, with 0.1 going to debt and 4.618 going to our general fund. So moving on to sales tax. So the City of Roswell has a local option sales tax. This is 1 penny that's collected in Fulton County, throughout Fulton County, and we receive 8.9598% of that 1 penny. As we mentioned last time as well, the allocation split is renegotiated every 10 years, and that time is this year. And I think we're supposed to, those renegotiations are supposed to start by this summer.
They start, yeah, formally July 1st. And do you know, and I apologize, I should know the answer to this, so I apologize for asking it. What's the percentage today if it's done on direct population representation as it was done 10 years ago? Right, it goes 8.9598, I believe, right, as a consequence of the lost negotiations. What would it be today?
I don't have that information with me.
No worries, my bad. I should know it. That's something we need to have clarity on before we go into this negotiation, obviously, because everybody else is going to.
Yeah, and that we've looked at that, and we've actually kind of had some information about, you know, various pieces of information we need to have ready to go for the negotiations as they start. And there's a variety of factors, I think, that go into play through that population, plus other issues like service levels and who performs what service and things like that. Looking at our FY23 projection for sales tax, we are factoring in a slight slowdown in FY23 due to decreasing or spending down of the federal aid that's been available over the last couple of years. Even since we spoke back in February when we looked at the 5-year forecast, obviously even things have changed in the last few weeks with war and inflation, continuing inflation, and just disruption in the markets. And from what we've seen, you know, the chance of recession, the people that look at that, has increased in recent weeks. From what we've also heard from economists in Georgia, that the low debt levels that Georgia residents have, combined with just the amount of savings that took place during the pandemic, that consumers are actually in a pretty favorable position to weather a recession. Just to give you an idea of that, so Georgia residents have saved about $75 billion over the course of the pandemic, which equates to about 2 months' worth of normal spending.
What about Roswell residents? Can we break down the data that descriptively?
I don't have the data for Roswell specifically. So we are factoring in, as I mentioned, we have we see in the current fiscal year, FY22, about 15% growth in our sales tax over the prior year. So we're anticipating bringing in about $30 million. In FY22, we are factoring in, like I said, a little bit of a decrease, with the idea being that spending is going to return back to normal levels, that we won't stay on that trend. So this gives you a history of our sales tax revenues. Average annual growth of about 3%. You can see the large jump here from $26.1 million last fiscal year to an estimated $30 million this current fiscal year. Slight decrease proposed or anticipated for FY23.
Ryan, do you know what the sales tax revenue is for Alpharetta, Johns Creek, our sister cities, Sandy Springs?
I don't. Not off the top of my head, I don't. That's easy to get.
Can we find that out? That'd be awesome. Milton, of course, too, but.
So now we'll move into our other general fund revenues. And I'll just kind of hit the broad categories and give you some details about those categories. So the first category is our business taxes. Our revised budget here is 16.7, an estimate of 17.3. Most of that increase over our revised budget is related to occupation tax. Our proposed number for FY 2023 is 17.8 million. The FY 23 proposed represents about a 2.8% increase over the estimate. So the main revenues that you see within this category include our franchise fees, electric, gas, cable. That's about $6 million. Our insurance premium tax, which is about 7.3 million. Occupation taxes total around $2 million. And our alcohol taxes are also included here, and that's about 1.6 million. The next category gets us into licenses and permits. Here our revised budget's about 2.3, our estimate's at 2.8. That's primarily due to increased activity with our building permits. And then FY 2023 proposed at 2.7 million. That represents about a 4% decrease from our 2022 estimate. The major revenue components here, as I mentioned, include our building permit fees, alcohol licenses, and other development-related fees, grading, things like that.
Ryan,
Yes.
can I make a comment on this?
Sure.
It's my perspective that there is an opportunity for us as a city to enhance our abilities to collect I think I'm on the wrong one, sorry.
Back. Occupation tax?
Perhaps, yes. There may be some opportunity there. And again, it's all anecdotal, so I don't have any good data, it's anecdotal data. And so I'm hesitant to say much on it, but there are some things that lead me to believe that we could be better at our correlation between ComDev and finance and the information flow. Jason, I think between finance and ComDev could be, there might be some lag there that might be of some value to the city.
And I will say we're working on that.
Okay.
We've actually already met. We are also working with the fire department and the work
Thank you.
they do through their annual inspections to just connect the dots between all the different departments.
Randy, is that something that we could make available to council as we're going through the budgetary process so that council has some understanding of kind of what we're discussing, that there may be some opportunity there before, because I don't want to go off on a wild goose chase publicly until I think, hey, we actually might have something there that's of some value that council would say, yeah, we need to be doing this.
Yes. So the next category gets us into charges for service. Here our revised budget's about 3.6. Estimate is roughly the same. Our proposed budget is at a little over $4 million. It's about an 11% increase over the 22 estimate. The major revenue component here includes our indirect costs, our cell tower leases, and our cultural arts center rentals. The biggest part of this is our indirect costs. It's about $3.3 million of the total. That is the funds that flow from the other city funds into the general fund to pay for the general fund services that those funds utilize. So the general fund covers the complete cost of legal, the city administrator, finance, payroll, all those types of things, but we provide services to the other funds. And so we actually have a formula calculation that we update annually to recoup some of the services that are provided to the other funds to support those funds. And so those funds actually reimburse the general fund for the general fund services that they utilize. So.
Is that all internal money we're talking about?
So when it comes from other funds, it's coming from the revenue source for that fund. So as an example, in our solid waste fund, it comes from the fees that customers pay. So we collect those revenues, and then based on the calculation that we update annually, we assess that fund, their portion of the general fund services that they utilize.
Okay.
Finally, we'll wrap up with our other revenues in the general fund. So these are some of our smaller categories and includes intergovernmental revenues. This is primarily Alpharetta's share of the RAPSTIC, the portion that they pay to help run that facility. The training center, the public safety training center that we share with Alpharetta. This also includes our fines and forfeitures that come through municipal courts, interest income, and miscellaneous revenues. I do want to point out here, within that miscellaneous revenue category, this includes transfers into the general fund. And I've listed here kind of what we are proposing for transferring in from other funds. So from our hotel motel fund would be $850,000. That's unrestricted funding that can be used for any purpose. Our auto rental excise tax, $425,000, and I'll get into that a little bit more detail in just a moment. And then Stormwater Fund transfers in $33,000 to support the duties of one position that works in ComDev. Yes.
Just while we're on this tab, the 850,000, what percentage is that of the total? Is that 60% of the total that's going to be collected that we're going to transfer in?
So annually, it's the unrestricted portion is 37.5%.
Oh, okay, so that's 37.5% of the total.
But we also had some accumulated funds from the prior year that we're using up as well. So it's annual plus accumulated fund balance.
That's what the 850 is. Okay, thank you.
Gonna just follow up on Christine's question, just from clarification, since we're talking about it. The hotel motel fund, 47% or 43%? 43%, correct? Goes to CVB,
Correct, 43.
and there's 57% left over. But of that 57%, what's that 850 represent?
So that 850 represents just the unrestricted portion that can be used for any purpose that the mayor and council want to use it for. There's another piece to the puzzle, that's the tourism product development portion. That's about 18.75% of the total, and that's the one that has to be designated for projects that enhance tourism in the city.
So just for clarity's perspective, so just people know what the hotel motel tax goes to. 43% goes to CVB. 18.75% goes to
Tourism product development.
tourism product development. So leave 50, so basically, that's if I'm right, it's 61.75% of the tax is accounted for in those two areas, leading off 38.75%. Am I doing that correctly? In my head, that goes to the general fund.
37.5.
37.5, my bad.
Yep.
37.5. So the 37.5 of the hotel motel tax goes into the general fund.
Correct,
The rest of it is specifically allocated for two designated targets.
correct.
Just to follow up, the 18.75 does come to our city, but we are restricted to spend that in parks, or could you give us some example of where we need to spend that?
Sure. The state law provides a plethora of examples of what we could use it for. If we're thinking about the things that the city does, parks and trails could be used for wayfinding signage, performing arts facilities, museums, convention facility. There's all kinds of things it could be used for. So.
Just as a follow-up, Ryan, so who's making decisions on who spends that 18.75%?
The mayor and council.
The mayor and
as
council.
part of the annual budget process.
Okay, very good, thank you. And who makes the decisions on who spends the 43% on the CVB?
We don't have a choice there unless, we don't have a choice because it has to go to the city's destination marketing organization, which they've designated as the CVB.
Very good, thank you, sir.
Yes.
Going back to a conversation that we had a couple of meetings ago about the recycling transfer station and opening it up to the neighboring municipalities, would that be an other revenue or would that be a charge for service? Should we open that up?
That would actually go into our solid waste fund, which it's actually another slide in a little bit, but yeah, it goes into that specific fund. So. Yes.
Okay, last question, and then we can go to the exciting water and sewer fund. COVID, our COVID relief funds, where are they in this, where are they reflected in this budget?
So we maintain those in their own separate fund.
Okay, that's,
so, yeah.
you'll get to that slide, thank you.
Well, I don't actually have a slide in it of it because there's nothing going on there right now.
Okay.
We've collected the first half of the payment, and we'll get the second half in June, and it'll sit in that separate fund until mayor and council decide how to allocate it out.
So we collected about 5 million,
Right?
Okay.
Yeah, 5.7.
5.7, thank you.
One last question before you leave this slide, I promise, right? So, not a bad thing that fines and forfeitures are expected to go down in FY '23. Obviously, it's always a good thing from a public perspective when you have less fines and forfeitures. But why do we have such a significant decrease projected for FY '23?
So there's one very specific reason for that, and the reason is so the city currently collects revenue from the school zone fines, speeding fines that the city receives, and we don't budget that. We don't at the beginning. We recognize it as it comes in because those funds have to be spent for public safety purposes. So you can see in the revised budget, it's not reflected there. The estimate includes what we have received so far. But again, we don't budget for it up front because we prefer to wait and see what it's going to be as we collect it.
Well, let me be a politician for a second and expound on this. The real reason is because we're not capturing a significant amount of money that we should be capturing from arrests because we don't have a facility to place people when we arrest them specifically for DUIs. Currently, the city is arresting a minimal amount of DUIs, just like our sister cities, because of the inability to house people when we make an arrest. So not only is it affecting public welfare, public safety, but it's also affecting public income, i.e. fines and forfeitures. And the second part of that is all the more reason why I think it's important that we continue to double down as we talk about this in our budget this year of how we continue to increase the pay for our police officers, because that, for me, is a good investment. So fines and forfeitures is part of the decrease. There is less arrest, less money collected specifically on DUIs as one of the significant matters there. So there's a significant part of this that I think is important to all of our residents. Obviously, we don't want to be in the business of collecting more fines. We don't want that's not the purpose of government. The purpose of government is to keep people safe, living with one another. And part of that falls under public safety, which is one of the things we do, that if you break the law, there is usually a fine for that, or some kind of other type of punishment. But there's a financial piece of that does equate to the city, and there's real harm being done to the city that we really don't talk about much. And it's kind of in that number there, so that's why I wanted to address that for a second.
And I think if you look at the general trend if you were to look at a history, you would definitely see the trend of fines and forfeitures are going down.
City Attorney David Davidson.
I just wanted to clarify, it's not that we're not making the arrest for DUIs. We are making the arrest, but once they go down to Fulton County, they go into their system and they do not come to our court. So we do not recognize the fines on those DUIs. Sorry, just wanted to.
No, I think it's a good clarification because I'm a public official and David's wanting me to be very careful about what's said here. But there is a real problem from a public policy perspective in North Fulton County as it relates to the inability to house people when they're making arrests, and it impacts the number of arrests are made. So David's speaking from a legal perspective, protecting the city, doing the right thing. But as a resident, right, I find it egregious that it does impact the ability of law enforcement in the city of Roswell and our sister cities of Alpharetta, Milton, Johns Creek, Sandy Springs, to be able to properly make arrests based upon the number of instances that are happening, and to think that is being impacted today, and think otherwise because of the inability to process and adjudicate and to bench and to put people in a place where you can hold them for a period of time based upon the offense, that is not occurring at the rates that it should be occurring. And so David, from a proper legal perspective, is saying the right thing. But I'm saying to you, as a resident of the city of Roswell, it's egregious what the city is participating in, as well as the city of Alpharetta, as well as the city of Sandy Springs, as well as the city of Milton, as well as the city of Johns Creek, because we don't have the facilities to process arrests. And it does impact the arresting behavior of law enforcement. So, David, thank you for being clear. Thank you for being the legal representative of the city and speaking to that in a very logical way. But my job is to be truthful. My job is, as the mayor of this city, is to say it's a real issue. And we're going to deal with this when we talk about the budget and when we talk about police pay. And then, one of the things that we talked about, and we're still talking about, is that we have to find some kind of jail solution for the residents of the city of Roswell to protect the city of Roswell residents. I don't know what that looks like today. People pass it off from a monetary perspective, but it has real implications. And you can kind of see how I'm going sideways on this because it's a real deal. And I don't like playing pretend when I know things are happening that shouldn't be happening. And I don't really care what any other politician thinks about the matter at the state level or the federal level or sister city levels. I know what's occurring. It's egregious. And it affects the safety of you and your family and every other family that's in the city of Roswell. And it bugs the stew out of me that we haven't solved it yet. Now, take on that with the finance piece.
Thank you. Any other questions on the general? Sorry. Any other general fund questions?
That's what you get for not doing the state of the city last week, which I asked you to do.
So we'll move on to some other highlighted funds. Starting with our water and sewer fund. So you can see here our revised budget, 4.8. Our estimate is to come in a little bit lower than that at 4.7. Our proposed revenues for FY 2023 is a little over $5 million. That includes the previously approved 4% rate increase that goes into effect July 1st of this year. You can see there's also an approved rate increase scheduled for July 1st of the following year, FY 2024. And based on the information that we provided to you in our forecast, we are projecting a rate increase of 4.5% going into the outer years of this forecast. And again, that's to address just inflationary increases as well as allowing the department to continue to accomplish the capital plan that they've set out, about $500,000 annually, as well as supporting the annual debt service associated with the water plant. And this was the graph that we showed you at our last meeting when we talked about the 5-year forecast. Our solid waste fund revenues, our revised budget is $14.6 million. Our estimate is $15.3. Our proposed is $12.6. The main reason for that big decrease that you see there going into FY 2023 is that with the construction of the new transfer station and the issuance of debt service for that, these two numbers include the loan proceeds, about $3 million associated with that. So in a typical year, we're about $12.6 million in revenues. In this fund, as we talked about last month, Mayor and Council had previously approved a 3% increase in FY 23 and 24. We are projecting and recommending a rate increase of 5% on the residential side and 4% on the commercial side. That's primarily to address the impact of the waste management, yard waste, and recycling contract. It's about an increase of almost $700,000 with projected annual increases of 4% going into the future.
I have a question.
Yes.
Sharon, we haven't gotten that addressed yet with our sister cities to obfuscate some of this cost, to offset some of this cost so that this is potentially relegated so there's not a significant impact to our residents?
We're still in conversation with them as far as their participation in the recycling center and what revenue we would recognize as a part of that agreement. So we're still working towards that.
Is this as a direct result of Councilman Palermo not being here tonight and not helping you out on the negotiations?
No, sir.
What do we need to do? Is there anything that I can be of service to help you with this?
I think we would probably want to have a conversation offline about
Okay.
how we want to attack that, but I think there are some conversations that we need to move forward with.
Very good. Thank you, ma'am. Appreciate that.
So again, this is the same graph that we showed you last month in terms of a 5-year forecast for our solid waste fund. Moving on to our stormwater fund, here we have a revised budget of $3.3 million in annual revenue, an estimate right on target at 3.3, a FY23 proposed number of 3.5. Here again, the mayor and council had previously approved a 2.5% increase in 23 and 24. We talked about this last month, but we are projecting and recommending an increase of 4% throughout the course of the forecast, including FY23. And those rate increases are needed to address the ability of the department to perform their capital improvement program, as well as to rebuild their emergency reserve, which took a little bit of a hit this fiscal year with some emergencies that arose. Moving on to our hotel motel tax fund, we've talked a little bit about this already, but our revised budget in FY 2022 was $840,000 in total revenue. When we were working with the CVB on this number almost a year ago, didn't really have a clear idea of how quickly revenues in the lodging industry would recover. They've done a lot better than what we anticipated, so we're estimating about $1.5 million in revenue for the current year, with a slight increase projected for FY 2023. This is the 8% tax that's paid on hotels and short-term rentals in Roswell. That's the other thing that has kind of helped this revenue source is the state law that passed that allowed us to collect lodging tax on short-term rentals, Airbnbs and VRBOs. We're seeing anywhere from $20,000 to $25,000 a month in revenues associated with short-term rentals.
In real terms, percentage-wise, how are we doing on that? The actual collection, how much opportunity is there in that particular arena?
In hotels across the board or just
No.
short-term rentals?
Short-term rentals.
It's hard to know because the way that the state law is structured is that the companies report to us. We have the ability, I think, to ask for backup documentation. We haven't gotten to that point yet because it's relatively new. But on a monthly basis, when they remit revenue to the city, they do not have to provide any kind of supporting documentation for that. So it's
Wow.
kind of on their own, but we have the option, I believe, and the ability to kind of, as we do with other hotels, we can request that information to try and document and ensure that they're reporting what they should be reporting.
So, I sound like I'm grandstanding on everything tonight. That's crazy. So you're saying that if I decide to use my house as a VRBO, right, which a lot of people do, it's a great idea, it's great service. I don't have to submit to you any sales documentation of what I actually rented my home for?
Well, it actually all flows through the company that manages it. So Airbnb, we receive one check from Airbnb on a monthly basis for everything in Roswell that's on Airbnb's site. And so that's how the law is structured. And like I said, we have the ability to ask, and I'm sure we will, but we don't receive anything from them monthly in terms of, aside from just the funds.
As a professional in the business, if you came in from the outside, what would be the first question you would ask?
We would want to make sure they're paying us the correct amount.
Yes, sir. Secondly, Airbnb is not the only company engaged in this service in Roswell, is that correct?
That's right.
They're not the only ones, right?
Right.
So there are others.
Right. We also receive checks from, I believe, VRBO. There's some of them that are affiliated, like HomeAway, Expedia. we receive revenues from those sites as well.
What if Councilmember Worthland and Councilmember Hills decide they want to start renting their home for income, their second home and the third homes, they both have a lot of homes, and they start doing that? What is do you have any knowledge of that?
No.
Does the law require that those folks fall into the same consideration of the law, do they not?
Yes, they would still be required to collect the 8%.
So I'll go back to my silly first question. Can we start ascertaining actually the potential of how much we are collecting versus how much we could be collecting in terms of number of, let's call them businesses, right, that are participating in this business?
Yes, we can look at that.
Because the law is there for a purpose, and that is for the purposes of collecting that tax. And obviously, if I'm participating with a VRBO and I'm paying that tax, obviously we need to know how much we're collecting. But two, if I'm someone who's not, I see that as an unequal playing field, and it's certainly obfuscating, I think, the intention of the law.
And I believe, I'm not sure if Mr. Davidson knows this or not, but I believe the law that was passed, is that just applied to the sites that manage short-term rentals, not necessarily, if I decided to do it all my own, would the city have to step in on that aspect?
So the city would have to step in on that aspect. If it was an individual property owner, you'd have to find a way to determine how they're advertising or how they're getting the people, but they are required to collect the 8%.
I think most cities that were already doing this require those types of businesses to register with the city, obtain a permit, and that's the way that we can track it and know they exist. And
Which goes me back to why earlier I said I want to go off on that. I don't want to go off on that tangent because it's anecdotal, because I don't have any data. But to me, I'm suggesting that I think there's an opportunity there for us as a city, from things that I am ascertaining, that there is some opportunities that people who have businesses perhaps are not registered as businesses, not paying taxes as businesses. And that's obviously, to use a poor word, not fair to the people who are doing it, to the businesses that are participating. So, there's a responsibility as a city, as the governing organization, to rectify that, and two, also to receive the income that we receive from others. And I think people would be mad at us, residents would be mad, is why does that person pay and why does that person not pay? And I think that's a responsibility. It's something we need to solve.
we will look into that. Next, we have our auto rental excise taxes. So here we have a revised budget of $300,000, and we're estimating to collect right at $300,000. A proposed number, a slight increase of $315,000. This is the 3% excise tax on certain vehicle rentals in Roswell. And you have there before you kind of the allowable uses. This is set by state law, promoting industry, trade, commerce, and tourism, capital projects consisting of convention, trade, sports, rec facilities, or public safety facilities, or the maintenance and operations associated with those types of facilities. To date, as I mentioned before, these funds have been transferred to the general fund, and the funds have been used to support the city's contribution to Roswell Inc. Since this has been in place, which has only been about 3 or 4 years. So those are all the revenue information we have. We have a few more slides for you related to kind of some comparisons between our neighboring cities and Roswell. And this is some information that was requested back a couple months ago, and we're providing that to you now. We kind of kept this information pretty high level, but if any questions or more specific needs come up, we'll be glad to get that information for you. We wanted to start with some property related information. So total property digest, this is tax year 2021. So you can see Roswell's right in the middle, 6.6 million as we talked about earlier. Sandy Springs at 10.5, Alpharetta slightly above, with Johns Creek slightly below the city of Roswell. The next slide gets into how the digest is split among the types of property, residential versus commercial and other. So you can see in Roswell, we're roughly 75-25. Alpharetta is roughly 50-50. We're more in line with cities like Johns Creek. They're about 80-20, 80% residential, 20% commercial. Sandy Springs is right at 60% residential and about 40% commercial. Taking a look at millage rate and how we compare to our other cities, neighboring cities. So we are the second to lowest millage rate among the North Fulton cities at 4.718. Whether you're looking at M&O or debt or the combination of the two, we are the second lowest millage rate among the North Fulton cities. Alpharetta has the highest at 5.75. Johns Creek is below us at 4.376. And then a quick comparison of homestead exemptions among all the different cities. All the cities in North Fulton have the floating homestead exemption. The cities of Alpharetta, Johns Creek, Milton, and Sandy Springs all have a basic homestead exemption that applies to all residents of that particular city. You can see it ranges from $15,000 to $45,000. All cities except for Sandy Springs have a basic senior exemption. Ranges from $2,000 in Roswell to $25,000 in Alpharetta. Certain cities have a specific exemption for seniors that is income qualified. Again, that ranges from $10,000 to $20,000, $8,000 in Sandy Springs. And then finally, 3 cities in North Fulton have specific senior exemptions that either exempt the full value or freeze their particular assessment at a certain year. And that's, they have to meet some pretty stringent eligibility requirements, age, income, I think also disability in some instances as well. We also looked at general fund expenditures by department across other cities, and I just wanted to provide a little bit of background before we showed you those numbers. So we pulled this information from the budget documents that we looked at from all of our neighboring cities. Obviously, each city kind of has their own way of doing things, the departments they have, what functions fall within those departments. And I'm saying that just to, when you see what I was on the next page, there's a lot behind those numbers. There's a larger story there. Just to give an example, so in Roswell, our building operations division manages most of our facilities, is housed under administration, and Alpharetta, their facilities division, falls within public works. Administration and public works or transportation kind of were the largest and most widely varied in terms of the functions and the divisions that exist among the neighboring cities. And of course, if we would need to do more analysis on this if you before you made any particular decisions or in order to really provide you a proper evaluation of the service levels among the different cities. But this gives you an idea of kind of how that stacks up across cities. Basically, what we tried to do was pull information from other cities and match them to the setup that we have here in Roswell. Some things I will point out. As I mentioned, transportation and public works, that was widely varied in terms of the functions that exist within each city. Same for administration. We did split out some other items here, so capital transfer from the general fund for capital projects, and you can see the wide distribution of numbers between all the different cities. The other thing I'll point out too is that Alpharetta has a combined public safety department. And so as we tried to split out their costs, they have an administrative function, and we distributed that proportionally among the police and fire. So that is a calculated number for Alpharetta in terms of the split between police and fire. When we take those numbers and we look at it on a per capita basis, you can see here what the general fund expenditures are per capita. Alpharetta is at roughly $1,130. The city of Roswell is at $867. Again, this is all a result of the various functions that exist within their general fund. I know, for example, in Alpharetta, stormwater is a general fund activity and falls within public works in their general fund. We also looked at general fund reserve policy, and we are pretty consistent across the board, 25% in Johns Creek, Milton, and Roswell, 23% in Alpharetta, and we were not able to confirm that number in some things. The last thing we looked at were FTEs, full-time equivalents per 1,000 residents. These are general fund full-time equivalents. So here again, you can see roughly follows what we saw with the general fund expenditures. And again, is a function of what activities they have within their general fund. So Roswell is about 5.1 FTEs per 1,000 residents. Alpharetta is at 6.4 FTEs per 1,000. The other thing that's really driving this too is if any of these cities contract out major portions of these services, that would not be captured here in the FTE count that you see. Yes.
Before you go to next steps, or if you're done with this part.
Yes.
Could you just go back to slide 22, please? I know we're pressed for time, but I just wanted to hit this. Actually, it's the 22 on the graph with the residential and the commercial, so that would be the, yeah, there we go. In the commercial, is that multifamily commercial properties in there?
Yes.
Okay, so I just wanted to clarify this for my colleagues, because that is, actually Ryan and I had been working on these numbers on another project that, the growth in that, what's very interesting to me from 2016 to 2022, the multifamily growth was roughly 57%, whereas the actual commercial growth over that period was just 3%. And that 3% would, over a number of years, would be perhaps the value of the property. So that's why it's so important that we're looking to build our commercial properties and bring properties in like $50 million and $100 million developments, so that that commercial piece can start being a bigger part of the tax base. But it's just disappointing to see that it's been flat basically for 10 years.
That is a brilliant insight, Christine. And I think the question I would have, just from a standpoint, and don't expect it tonight, Ryan, it's so fun peppering you, you know that, is obviously, how do we compare in our commercial property taxes in Roswell compared to our sister cities in terms of a comparative value? What do we charge versus what they charge? I think that would be interesting to know. I think most, we have incredibly profitable real estate investment trusts that own the overwhelming majority of multifamily properties in the city. And what has been the commensurate tax value and increases of that compared to the individual property owners in the city, that would be worth knowing, as well as the commercial businesses outside of multifamily properties. Just some kind of contrast so that we have an understanding of what we're looking at from a tax perspective, both historical and comparative. Sorry. And I, for one, know that the rest of the council is very upset with you because they thought you would be done 50 minutes ago. And that we are going, by the way, I know everybody wants to welcome Councilman Palermo. He's got dinner ready for us for 5 minutes. But yeah, that would be helpful. Thank you, Christine. That's an excellent point. And I want to say something. I got to say something in all seriousness, and I'm going to say it again, hopefully in council. May not be tonight, maybe tonight. But Councilmember Hall and Finance Director Ryan Luckett are to be magnificently commended in all seriousness, because Councilmember Hall and Ryan Luckett have been working for the last 3 months on one of the 11 pieces of our 100-day plan, and they're the first ones to knock out the first one of the 11 plans, in the sense that they were to review priority-based budgeting And they came up with a solution that's been fantastic, in that we are going to use zero-based budgeting on all personnel, and that we're going to use priority-based budgeting on all other budgetary matters, with the possible extension of some zero-based budgeting when applicable. And what's most significant about that is that the city, beginning FY '23, will eliminate incremental budgeting in its budgeting process. And that's a major step and a major accomplishment by Christine Hall and Ryan Luckett. And I can't tell you how,
It's all Ryan.
and I can't tell you how impressive it is. Like I said, it doesn't sound sexy. It's a big deal. It's a big deal to this city. It's going to be a big deal in FY '23. 24, 25, 26 as we go on. It matters. It's going to matter a lot to our budgetary process. And massive kudos to Christine and Ryan for getting that done. So thank you. And I can't wait for you guys to do your video together. You're way over past on this. So
I have to give a lot of credit to all the departments because they've put in a massive amount of effort into our priority-based budgeting process. So they've worked tremendous amounts of hours on that over the last 6 or 8 months. So we greatly appreciate everybody's effort in that.
Ryan, do we have anything else?
Just last thing, wrapping up, we'll be discussing the adjustments, the fee adjustments that we've talked about throughout the budget process. And the final approval, requested approval of that will be through the actual budget adoption. Our next budget work session is scheduled for April 11th, and that'll be our partner organizations will be present to talk to you about their budget requests for FY 2023.
Does any council have any questions left for Ryan before we leave? Do I have a motion to, with that being said, do I have a motion to adjourn?
Motion to adjourn.
Motion to adjourn seconded. All in favor, raise your hands. We are adjourned. See you in 7 minutes.